it is still your number one business radio, Broad Street Radio. My name is Charles Fakrua, your regular host when it comes to health and wellness. Yes, how has it been? How has your week been in terms of wellness and health? It has been very, very hectic with the traffic situation, the fuel issue, people running up and down. Yes, most of us will not even begin to check our health, but it is very, very important. The last time we were able to talk about financial stress, how it affects the mental health, and of course even the physical health of workers. But today I want to dedicate today's program to women. And when I say women, I mean our wives, our mothers, our grandmothers, our sisters, our nieces, our cousins, colleagues, female colleagues in the office. Because this particular topic I want to discuss today affects only women. And this can affect their productivity in the office. So you as an HRO, you need to understand whether you are a male or a female. Of course, for the female, they won't understand. But for the male HRO, you need to understand the welfare of these women in terms of today's topic, which is endometriosis. I hope I got it right. Endometriosis. Yes, it affects women and girls, and it can affect their productivity in the workplace. So we know that there's a lot of women entrepreneurs, there are a lot of career women in the workplace. Women are all over the place doing a lot of good work. We as men, we don't have a choice than to support them. You cannot be competing with your wife or your sister. All you need to do is to give them that support. And if you understand the nature of a woman, of course, it's totally quite different from that of a man. Their psychology, their physiology, their physical makeup, their emotions, everything is totally different from that of men. So we as men, we just need to support them. When people talk about gender equity and all that, for me, both parties, the male and the female, need to work together to achieve one goal: improve quality of life. And that is how the Almighty God has made it to be. We just need to collaborate. But I now realize that these females, you females, are even more stronger than the men. Imagine a man and a woman, they are both working parents. They've gone through traffic. They are at home. The man will still sit down and say, okay, but I'm going to prepare something for me. And they both just cried, maybe at the same time. Or the man even came before the woman. So you can see. And she will not even complain. She will go ahead and begin to, do things from the kitchen. So today's program is dedicated to all the women in the workplace. We have come to realize that you guys are the greatest. You guys are good. We just have no choice than to celebrate you. Yes, for a young girl, a young woman, endometriosis is a common condition. Endometriosis is a painful condition that can impact your everyday life, whether at the workplace, at your shop, at home, in school, wherever you are working. When you have endometriosis, tissues similar to the lining of the uterus, your uterus is your womb, grows in other places within your abdomen and pelvic area. They are supposed to be in the uterus. Now, when they now grow in other parts of your body, within your abdomen and the pelvic area, endometriosis can cause painful and heavy periods, as well as fertility issues. So when you have this condition, I think the first thing to do is to see your caregiver. It is very, very important. So we'll be looking at the symptoms, causes, diagnosis, test, management, treatment of course, prevention, outlook, and of course the prognosis. But let's first of all look at the overview, of endometriosis. The overview. In endometriosis, endometrial-like tissue grows outside the uterus. If you are looking at the diagram, you can see that the endometrioma, you can see there on the ovaries, you can see some of the tissues growing in the outer part of the uterus, so you will see it clearly there. However, let us see what is endometriosis. Endometriosis is a condition where tissue, like we said earlier, tissue similar to the lining of your uterus grows on other parts of your body. When this tissue grows in the wrong places, it can cause you to experience uncomfortable symptoms that can impact your daily life. Some people with endometriosis also have issues getting pregnant. So if you are suffering from infertility, of course, when your caregiver, mostly your gynecologist, when they examine you, they'll be able to tell you. The endometrium is the inner lining of your uterus, of your womb. The tissue is what you shed during menstrual period. Think of endometrium as layers of tissue that build up along the inside lining of your uterus. Okay? When you have a period, these layers fall away from the walls of your uterus and leave your body. Now, if you get pregnant, the endometrium helps support the early stage of development of that pregnancy. Okay? Now, what if you don't get pregnant? When you have endometriosis, endometrial-like tissues grows on other organs or structures. This tissue can grow within your abdomen, pelvic, or even chest. This tissue is hormonally sensitive and can become inflamed during your menstrual cycle. These areas of endometrial-like tissues can cause ovarian cysts, superficial lesion, deeper nodules, adhesions, tissues that connect your organs and bind them together, and scar tissue within your body. A few places you can develop endometriosis include the outside and back of your uterus, the fallopian tube, the ovaries, even your vagina, peritoneum, the lining of your abdomen and your pelvic, bladder, the ureters, of course the intestine, your rectum. Even you can also have it in your diaphragm. That's the muscles near the bottom of your chest that plays an important role in breathing. So those are some of the places where you can have it. How serious is endometriosis? Endometriosis is a common condition that can interfere with your everyday life. It can affect your performance in the workplace. It can affect you as a student. It can affect you as a business person. It can affect you wherever you find yourself. It can cause long-term pain, disruption to your menstrual cycle, and fertility issues. The symptoms of endometriosis are often manageable with treatment. The next question we're going to ask ourselves: who can get endometriosis? Endometriosis is a condition that most commonly impact people between the ages of 25 and 40. Between the age of 25 and 40. It can also happen to younger women, during their teenage years. Although many people find relief from endometriosis symptom after menopause. Of course, we don't understand what menopause is talking about. I think that would be a separate discussion when we are looking at women issues. We're talking about menopause in another topic on its own. So it can still cause discomfort and pain even after menopause. What are some of the risk factors for endometriosis? There are some factors that can place you at a higher risk of developing endometriosis. These factors include, there are so many of them, look at the family history of endometriosis. If you're having maybe your mother, your sister, somebody who has it, the age you first start having periods, usually people who begin menstruating before age 11 may be at a higher risk. The length of your menstrual cycle, shorter time between periods, and the duration of flow, how many days of bleeding. Of course, the women folk I'm talking to will understand what I'm talking about. Of course, defects in your uterus or fallopian tubes. I'll take that again. These factors, that's the factors that can place you at a higher rate. So, family history of endometriosis, the age, those people start menstruating before the age of 11, the length of your menstrual cycle, and of course, shorter time between periods, of course, how many days of that bleeding, then defects in your uterus or fallopian tube. Is endometriosis, is it genetic? Is it hereditary? Although experts don't know the exact cause of endometriosis, they do see a connection between a family history of the condition and increased risk of developing it at some point. If another person in your family, your mother, your grandmother or sister, has endometriosis, talk to your healthcare provider about your risks. So once you have seen that, please do not hesitate to see your gynecologist. That's your healthcare provider when it comes to that issue. Symptoms and causes. What causes endometriosis? The cause of endometriosis is unknown. When you have endometriosis, tissue similar to the lining of your uterus grows in wrong places. When it develops in places like the outside of your uterus, that's outside of your womb, your fallopian tube, ovaries, intestine, and within your pelvic cavity, it can cause painful symptoms. This pain is related to increased inflammation and often fibrosis, and of course, adhesions. When endometrioid-like tissues grow outside your uterus, it can cause scar tissues, which is the adhesions. These sections of scar tissue can fuse your organs, creating connections between them that normally wouldn't be there. This can lead to discomfort and pain. What are the symptoms of endometriosis? There are many symptoms connected with endometriosis. The main symptom is pain. The pain can be intense or mild. It can typically be felt in your abdomen, pelvic region, and lower back. Although endometriosis is a common condition, not all people experience symptoms. Sometimes you can have endometriosis and not know until it is found during another procedure or investigation of infertility. Of course, primary infertility and secondary infertility. After a woman has been married, I've been having active sex for over 6 months and there is no pregnancy, no conception. Of course, when they begin to see their fertility expert, the gynecologist, and that is when they begin to see that you are suffering from endometriosis. Okay, people who do experience symptoms of endometriosis may have very painful menstrual cramps, abdominal pain, back pain during your period or in between periods, pain during sex, heavy bleeding during period or spotting, light bleeding between periods, infertility, that is difficulty becoming pregnant, painful bowel movements. There is no connection between the symptoms of endometriosis and the severity of the condition. Some people may have very few patches of endometriosis and still experience severe pain. Other people might have severe endometriosis but not experience a great deal of pain. What are your first symptoms of endometriosis? Many people experience pain during periods from endometriosis. This pain is often felt in your abdomen, lower back and pelvic area. Periods can also be heavier than typical, and there can be spotting. You know, when you talk of spotting, light bleeding between circles. How do we diagnose and test this endometriosis? How is endometriosis diagnosed? In many cases, an endometriosis diagnosis will start with your symptoms. Painful and heavy period might cause you to reach out to your gynecologist, your healthcare provider. Once at an appointment, your provider, typically, of course, is obstetrician and the gynecologist, obs and gynecologist, may start by asking you for your personal medical history about any previous pregnancies and if any other person in your family have endometriosis. Your provider may do a pelvic exam. If your healthcare provider needs more information, they will likely perform pelvic imaging, starting with an ultrasound. Depending on your symptom and physical exam, an ultrasound result, an MRN, that is magnetic resonance imaging, may also be ordered for further endometriosis mapping. A laparoscopy may be offered for both definitive diagnosis and treatment. They have to confirm, so a laparoscopy may be offered. It can be a useful way to confirm endometriosis because your surgeon doing the procedure can use a small camera, which they normally call a laparoscope, to look inside your body. A biopsy, that's a small tissue sample, might be taken during the procedure. The biopsy will be sent to a lab to confirm the diagnosis. Sometimes you find endometriosis by accident. Not all people who have endometriosis will experience symptoms. In these cases, your provider might discover the conditions during a different procedure. How do we manage and treat it? What is the treatment for endometriosis? Your healthcare provider will help create your treatment plan for endometriosis based on a few factors, including, they have to look at the severity of your endometriosis, your plan for future pregnancy, your age, severity of your symptom, often the pain. In many cases, your treatment plan will focus primarily on managing your pain and improving fertility issues. If you are planning on a future pregnancy, this can be done through medications and surgery. Medications are often used to help control the symptoms of endometriosis. This can include pain medications and hormone therapy. It's very, very key. Of course, your gynecologist will explain to you properly. Hormonal options for suppressing endometriosis can include birth control. These are multiple forms of hormonal suppression options, including combination options using estrogen and progesterone or progesterone only options. These come in multiple forms, including oral birth control pills, patch, vaginal ring, birth control shot, implants, of course, IUD. This hormonal treatment can often help people have lighter, less painful period. These are not options for patients attempting pregnancy. You can also have the gonadotropin releasing hormone as GnRH medications. These medications are usually used to stop the hormones that cause your menstrual period, your menstrual cycle. This basically puts your reproductive system on hold as a way to relieve your pain. The gonadotropin releasing hormone medications can be taken as an oral pill, be by your mouth or shots or at nasal spray. You also have the danazol, that is Danol cream. This is another form of hormonal medication that stops the production of the hormones that cause you to have period. While taking this medication or for endometriosis symptoms, you may have the occasional menstrual period or they might stop entirely. With all of this medication, it's important to note that your symptoms can come back if you stop taking the medication. That's why it is very important that you always go for regular checkup with your OBS and G. That's your obstetrician or your gynecologist. These medications aren't recommended during pregnancy or if you are actively attempting to achieve pregnancy. Talk to your gynecologist about the pros and cons of each medication before starting. So for any treatment plan, you and your gynecologist must come to an agreement so that you understand the pros and cons of each of the medications. Medications for endometriosis pain relief can include over-the-counter pain relief. You can also use non-steroidal anti-inflammatory drugs. In some cases, your gynecologist might recommend surgery as a way to confirm and treat endometriosis. There are always risks to surgical procedure. However, surgery for endometriosis can be an effective way to relieve pain. In some cases, improve fertility. Endometriosis is considered a chronic disease. Many people experience relief from endometriosis pain after surgery, but symptoms may return. Symptoms may return within a few years. The severity of your endometriosis could play a part in how quickly, if at all, it comes back after surgery. Your provider might suggest combining surgical procedure with medications for the best outcome. Your provider may recommend pelvic floor physical therapy with or without medication for central nerve pain. Surgical options to treat endometriosis include laparoscopy. In this procedure, your surgeon will make a very small cut in your abdomen, maybe usually less than 1 centimeter, and insert a thin tube-like tool called a laparoscope into your body. This tool can be used to see inside your body and identify endometriosis with a high definitive camera. Additional 5mm instrument can then be used to excise and remove some of the scars or the lesions. Another surgical procedure will be hysterectomy. Hysterectomy. In severe cases, your surgeon may suggest removing your uterus, your womb, based on the amount of endometriosis and scar tissue present. If you have other uterine conditions like adenomyosis and your desire for future fertility, if you have an hysterectomy, areas of endometriosis should still be exercised to optimize your pain relief. However, it is advisable that you seek counseling. Your gynae should counsel you very well before you go for that removal of the uterus, because it is very, very emotional for most women. If you have endometriosis and are trying to achieve pregnancy, maybe you want to do IVF. IVF may help you achieve that goal, so it's advisable that you can go for IVF. Can endometriosis go away on its own? I'm just imagining, can it go away on its own if you don't feel so much pain? In some cases, endometriosis can go away on its own. Over time, endometriosis lesions can occasionally get smaller and you may have fewer of them. This can also happen after menopause, which is often related to drop in the amount of estrogen in your body. For many people, endometriosis needs to be continuously treated to control symptoms like pain. It is important to maintain a regular appointment schedule with your healthcare provider so that you can work together on managing your condition long term. It is very, very important you make a regular appointment. What happens if endometriosis is left untreated? Over time, the endometrial-like tissue that grows outside of your uterus can cause cysts, adhesions, and scar tissues. This can cause you to experience long-term chronic pain, especially during menstrual period. Many people with endometriosis may also have difficulties getting pregnant. Treatment can sometimes help with this issue. As you age and go through menopause, the symptoms of menopause may improve. This is related to hormonal changes your body goes through during menopause. Can endometriosis be prevented? Endometriosis isn't a condition you can necessarily prevent. There are certain factors that can reduce your risks of developing the condition. But in some cases, you may still have endometriosis. There could be genetic reason that some people develop endometriosis. If other people in your family, mother, grandmother, have been diagnosed with endometriosis, talk to your provider, ask your gynecologist about your risks of also developing the condition. A few factors can reduce your risk of endometriosis include pregnancy, breastfeeding, maintaining a weight that's healthy for you, starting your menstrual period at a later age. What are the complications of endometriosis? There are several medical complications that can happen if you have endometriosis. People with endometriosis may experience fertility issues, difficulty getting pregnant. We've said that. This can sometimes be helped with treatment options like medications, surgery for endometriosis, or fertility treatment like IVF. People with endometriosis can also experience bowel or bladder issues. These may include pain with voiding or with bowel movement, or seeing blood in your urine when you pee, or your stool, of course, when you poo. With severe endometriosis of your ureter, that's the tube that carries urine from your kidney to your bladder, you can occasionally get swelling of your kidney. Endometriosis can occasionally impact your lung or diaphragm, which can lead to shortness of breath, chest pain, or lung collapse during menstrual cycles. Chronic long-term pain is another issue related to endometriosis. Your gynecologist will work with you to manage these issues to improve your daily life so that you can function optimally in your workplace, in your business, or in your school if you are a student or even a lecturer. Can I get cancer from endometriosis? Endometriosis is associated with a small increased risk of developing epithelial ovarian cancer, mainly including clear cell and endometrioid carcinomas. The risk is extremely low and no preventive screening is currently recommended. Can you get pregnant if you have endometriosis? You can get pregnant if you have endometriosis. However, people with endometriosis can have a difficult time getting pregnant. This condition can be a common cause of infertility. If you have endometriosis and want to get pregnant, talk to your gynecologist about the best treatment option for you. You might need to change your medication, or in some cases, pursue a surgical option to treat your endometriosis. Your provider will work with you to find the best treatment plan to help support a pregnancy. Can you still have endometriosis after menopause? Menopause is a time of major change in your body. One thing that happens during this transition is a change in the level of hormone in your body, specifically estrogen, that's the female hormone. There is a link between your reproductive hormones and endometriosis. After menopause, with decreased estrogen levels, endometriosis lesion often decrease. This can also mean that you no longer experience symptoms of the conditions, or they are less intense than before menopause. However, if you take hormones as a treatment for any symptoms you experience during menopause, your endometriosis may still cause symptoms. I want to conclude, but I will advise our women to please, when you see some of these symptoms, please see your healthcare provider. Of course, if it's an MO, that's a medical officer, a general practitioner, after examining you, it will now recommend you to the experts, the specialist, which is your obstetrician and of course the gynecologist. Endometriosis can cause you to experience long-term chronic pain, heavy periods, and difficulties getting pregnant. You can manage these symptoms by working with your gynecologist. If you notice any symptoms of endometriosis or having unusual painful periods, talk to your healthcare provider. And I have mentioned usually the specialist, the gynecologist. There are treatment options that can help improve your daily life and manage your endometriosis over the long haul. So it's a condition that you can manage, and you manage it very well, properly, and you can perform your duties very well as a worker and of course a wife at home. So once you have some of those symptoms, the earlier you see healthcare provider, the better for you. Women in the workplace, you can actually manage endometriosis properly, and you will perform your duties optimally in the workplace. So for HRO, please, if you are not a woman, you need to understand when cases like this come to your notice. You must empathize with these women because of what they are going through. It's not a death sentence. As long as it is properly managed, it will not affect their performance in the workplace. Thank you.